It's my pleasure this World AIDS Day to welcome you to the launch of the HIV Commission report. I am honoured to be a part of this special event. We are at a pivotal moment in time for the AIDS epidemic in England. The world and this country has set a goal to end new cases of HIV by 2030. That gives us 10 years to defeat a disease that has caused so much devastation, not for a year, but for over a generation. Right now, we have the chance to make an historic commitment that will see England lead the way in this next decade as the first country to truly end its domestic HIV epidemic and be a global example. We must seize that chance. To do so will take determination, vision, and collaboration. Three qualities I feel my own foundation, the National AIDS Trust and the Terence Higgins Trust, have demonstrated in coming together to sponsor and manage this independent HIV Commission. I'd also like to commend Dame Inga Beale and the group of commissioners who have so generously given of their time and talents to drive this commission to its powerful conclusions. And my thanks go to Public Health England and the Department of Health and Social Care under the guidance of the Right Honourable Matt Hancock for their enthusiasm to engage with this work. So today we launched the HIV Commission report recommending how England can end new HIV infections by 2030, gathering all the knowledge, expertise, innovation, research and energy from across this brilliant sector. We know testing for HIV is key. It is the best thing anyone can do to protect themselves and others. But now we need to make it policy to test at every interaction in the health service. It's not just the illness and death we can prevent, or the time and money we can save. It's the message that opt-out testing sends that this is normal, not shameful, not secret, not judgmental. This is part of how we end an epidemic that's been fueled by stigma for so long. I've been an AIDS activist for over 30 years. And in that time, my foundation has supported just about every HIV service in this country. To think that we now have a fully consultative report with a strong blueprint to lead us to ending this epidemic fills so many of us at this event today with hope and energy. I wish you all a wonderful launch. Thank you so much for your commitment and partnership. And here's to a landmark World AIDS Day.
I'm Deborah Gold, Chief Executive of the National AIDS Trust, and let me start by thanking Sir Elton for those inspiring words. And thank you all for joining us at this event to mark both World AIDS Day 2020 and the launch of the Independent HIV Commission's report. It's honestly awe-inspiring to see so many of you here, though I really wish we could be together in person. We set up the HIV Commission as a partnership between the Terence Higgins Trust, Elton John AIDS Foundation and the National AIDS Trust. And it was tasked with answering one question: how can we end new HIV cases in England by 2030? The commitment is government policy, but policy without a plan is meaningless. And that's where the HIV Commission comes in. We decided to do things a bit differently, to invite leaders from different sectors, from business, the charity sector, politics, and the health sector, to draw on their personal experience and to provide independence to the whole process. And alongside this group of commissioners, we tasked an exceptional group of experts to provide advice for commissioners, and we asked everyone to send us their evidence. We're really delighted with the results. It's not just a plan for ending new transmissions by 2030, but a roadmap to England being the first country to make this happen. And I can assure you this process has not been as smooth as we might have first envisaged, and it's not been without challenges, falling during a pandemic of a different kind. But the results have been, if anything, strengthened because of the commitment of our commissioners and the increased awareness of public health. Before I pass you on to our next speaker, please do join the debate, share the report and contact your MP to ask them to support the report. Use the hashtag #NotHIVby30 on social media. They say it's hard to get this country talking about anything other than COVID, but I know this community knows how to shout from the rafters. So let's make our vision heard and the powers that be know. We want actions to follow words. And now to take us through the report, I'm so delighted to introduce Dame Inga Beale, a leading British businesswoman, the former CEO of Lloyds of London and the chair of the HIV Commission. Dame Inga, over to you.
Thank you, Deborah. And having personally lived through the trauma HIV caused in the 1980s, I knew there had been real progress in treatment and outcomes since then. And I have friends who are living with HIV 30 years on from diagnosis, and they're thriving. However, I didn't know the sheer extent of the progress that's been made. I didn't know you could test at home for HIV and get a result within 15 minutes like it's a pregnancy test. I didn't know there was a pill you could take daily to protect against HIV. I didn't know a quarter of the new HIV diagnoses every year in the UK are among women. I didn't know the scandal that more than 4 in 10 people are still diagnosed late. And I didn't know that effective treatment suppresses the virus to such an extent that it can't be passed on to partners. Now, this has all been my privilege to learn as chair of the first ever HIV Commission. Just over a year ago, my fellow commissioners and I, not HIV experts, but successful in our own fields, were tasked by Terence Higgins Trust, National AIDS Trust, and Elton John AIDS Foundation with answering one rather daunting question. How can we end HIV transmissions in England by 2030? We travelled the country and were supported by a wonderful advisory group of experts, health professionals, academics, policy leads, and we met lots of people living with HIV. We heard first-hand patients' experience, good and bad. And one in particular sticks with me. A woman having to endure 2 health professionals discussing, in 2019, that's last year, double gloving before administering her treatment. Now, if this stigma is alive and well in trained professionals, it shows how far we still need to go. This need to fight stigma and fight health inequalities informs every part of our final report. Today, we're setting out our vision. England could be the first to end new transmissions. Now, despite all the laudable progress made so far, England is not yet on track to meet that 2030 goal. And that's unacceptable when we know we have the necessary tools to ensure no one else contracts HIV, but we're underutilising them. However, it's welcome that we have a government that wants to do better, has set a big ambition and is driving towards getting it. Get it right, and England could be the first country to meet this ambitious goal. However, the government must adopt our 3 recommendations. Firstly, England should take the necessary steps to be the first country to end new HIV transmissions by 2030, with an interim target of an 80% reduction by 2025. We're asking jointly the Department for Health and Social Care and the Cabinet Office to report to Parliament on an annual basis the progress on the recommendations that we've laid out. Secondly, national government must drive and be accountable for reaching the 2030 goal through publishing a comprehensive national HIV action plan next year in 2021. And thirdly, HIV testing must become routine. Opt out, not opt in, with HIV testing taking place right across the health service. To find the estimated 5,900 undiagnosed people living with HIV in England, we need testing, testing, testing. HIV testing must be normalised throughout our health service when you register with a GP or you go to A&E or have blood taken anywhere in the NHS. There must be an offer of an opt-out, not opt-in HIV test. And failure to make this change is missed opportunity upon missed opportunity to diagnose every case of HIV. We've seen the success of this approach with maternity services in the country. Maternity services show how transformative this approach to testing is, with near complete elimination of vertical transmission where a child is born with HIV. HIV testing is mainstream in maternity units, where midwives handle the associated issues with care and consideration, and critically, without judgment. The rest of the NHS must follow their example, and similar results will be forthcoming elsewhere. Another thing, the epidemic has not hit all communities the same, nor has the response to date. The drop in diagnosis for gay and bisexual men is not the same for gay and bisexual men of colour, let alone the Black African community more widely. Women are too often invisible in the discussion on HIV. The 250,000 annual sexual health clinic attendees that are not offered an HIV test, they are disproportionately women and women of colour. The trans community, it's failed time and time again. We're failing them. Black African women and men are less likely to know about the existence of PrEP, let alone benefit from it. COVID has highlighted to the country what we have known about health inequalities in the HIV epidemic for a generation. The HIV Commission believes that progress for only some and not for all is not progress at all. We're delighted that this process of consensus building has been supported by so many, and we welcome the support we have received from a wide range of people, including the Duke of Sussex this morning, who was with us at the start of this effort. He is very aware that this virus does not discriminate and is showing his support for testing to become a standard part of all of our lives when seeing our doctor or perhaps going to the local pharmacy. His mother was dedicated to tackling stigma, and he is committed to do what he can to keep chipping away at the stigma issue. Now it's over to the government to ensure England consolidates its place as a leader in the fight against HIV and uses our recommendations as a springboard for its own HIV action plan to see the country become the first in the world to end new cases by 2030. In a year that's often felt hopeless, what a message of hope that would be in England, the UK, and across the globe. The report, as I said, asks for Cabinet Office and the Department of Health and Social Care to do this together. So we are going to be joined by a couple of our ministers today. And first of all, we're going over to Matt Hancock.
Good morning. In this year when the health of the nation has been at the forefront of the public debate like never before, and while we've been working night and day to fight coronavirus and develop the scientific advances that will see us through, I've drawn inspiration from our fight against another killer pandemic, HIV, and the progress that we've made against this pernicious virus. When I was growing up, like for so many people, HIV was seen as a death sentence. But since then, thanks to the incredible campaigns and bravery of so many people, we've seen some amazing advances. I'm so proud that in England, the overall number of people with a new HIV diagnosis has fallen by over a third in the last 5 years. And I'm really delighted that we met our UNAIDS 90-90-90 target for the third consecutive year, and that we were one of the first countries in the world to meet it. This means over 90% of people who live with HIV are diagnosed, over 90% of those who are diagnosed are getting treatment, and over 90% of those who are treated have quantities of HIV so small that it's undetectable. But we all know that there is so much more to do, because every new case of HIV is one too many. 2 years ago, I announced our commitment to end new HIV transmissions by 2030. And I remember at the time being told that this is an ambitious target, but I know we can get there. And to help us get there, we've endorsed a new HIV commission established by the Terence Higgins Trust and the National AIDS Trust and supported by Public Health England. I'm delighted that you've published your vital report today on World AIDS Day. I'd like to pay tribute to all the members of the Commission and thank them for their hard work, and to Dame Inga for your expert leadership. I'm looking forward to working closely with you as we all pursue that 2030 goal. It is achievable and we must get there. The report contains some ambitious recommendations, and we're going to be working on them together, including the interim milestone of an 80% reduction in new HIV transmissions by 2025, as well as how we can expand access to testing even more widely. And we'll use your insights on this issue to shape our upcoming HIV action plan, which I am committing to publishing next year. So thank you. Today's report is a landmark document that will help us chart our future path to the elimination of new transmissions here in this country. And if this difficult year has shown us anything, it's that we also need to look globally to address global threats to public health, because nobody is safe until everyone is safe. So just as we're working on shared solutions to coronavirus, like equitable access to vaccines right around the world that will help to see us through, we want to make sure the advances that we're making here in the UK are shared by people worldwide. I'm proud that we're the world's second largest donor to the Global Fund, which is reallocating up to $1 billion to support prevention and treatment for HIV and other threats to global public health during the coronavirus pandemic. So we can make sure that this important work keeps going even in the clutches of this public health emergency, because we cannot let one virus undo the progress that we've all made in fighting another. World AIDS Day is a day to look back and remember those who we've lost to HIV, a virus which has brought grief to so many. But it's also a day to look forward and to reaffirm our collective resolve to meet that 2030 target. Because HIV is a virus that's taken too many people before their time. So let's all of us redouble our efforts to make it a thing of the past.
In the United Kingdom, there are more than 100,000 people who live with HIV. Every one of them deserves the best possible care and access to effective treatment to ensure that the virus can't be passed on. But at home here in Britain, we're at risk of progress slowing down. The rollout of the life-changing drug PrEP hasn't been quick enough, and more than 6,000 people with HIV are undiagnosed. Clearly, we must do more. And globally, the fight is at risk. Even before the COVID crisis, despite having the tools we need, we were not making enough progress to reach the UN AIDS goals. We must protect the gains made in the HIV response over the last 20 years, many of which UK international development funding has helped to facilitate. But there is hope. Today I'm really pleased to welcome the launch of the report, How England Will End New Cases of HIV. That's by the HIV Commission, the National AIDS Trust, the Terence Higgins Trust, and the Elton John AIDS Foundation. The Labour Party and I are absolutely committed to the goal of ending new HIV transmissions by 2030. There's nothing stopping progress but political will. We have 10 years to meet this historic milestone, but not a minute to waste. So on this World AIDS Day, we remember all those who've lost their lives in this epidemic and stand ready to end transmissions once and for all.
Thank you. We heard there from the Right Honourable Matt Hancock, Secretary of State for Health and Social Care. And then we also heard from Right Honourable Sir Keir Starmer, the Leader of the Opposition. And it sounds there as though we've got a real commitment by the government that they're going to put in place an HIV action plan for next year, which is fantastic. But now I would like to introduce our next guest, who has joined us live here, and that is the Right Honourable Michael Gove MP, Chancellor of the Duchy of Lancaster and Minister for the Cabinet Office. Minister Michael, thanks very much for being here live, and I will hand over to you. Thank you.
Well, thank you so much, Daminga. First of all, can I say on behalf of the whole government, a special thank you to you and all of your commissioners for the fantastic work that you've done. I mean, your report lays out a pathway to ensure that the United Kingdom can become the first country in the world to end HIV transmission. And you're asking the government to be more ambitious in the future. You've acknowledged that we've made progress, but there is still a lot more to do. And I think you and the commissioners are absolutely right to draw attention to what more needs to be done. As we've heard from Matt and from Kia, HIV has been a terrible scourge. It's taken so many people before their time. But thanks to science, thanks to the commitment of campaigners, thanks to the hard work of public health experts, we now know how we can beat this disease. And it's absolutely critical that we make sure that we've got testing in place. Testing simply hasn't been adequate so far across the entire population. It's also the case that we need to invest in the treatments that we know can provide an effective sort of prophylactic way of preventing the transmission of the disease. And if we can be in a position by 2030 to eliminate transmission, then I think that will be not just a liberation for people in this country, but it will be an example that we hope others can follow as well. But you're absolutely right, more work requires to be done. Matt is leading that work as Health Secretary, but it's my job in the Cabinet Office to make sure that all of government is working effectively together to support him. And the Prime Minister has asked me to work with Matt in order to make sure that the resources which are required are there, that there is no slackening in our determination to make sure that treatments are available, and also that we, even as we're dealing with COVID, with another terrible pandemic, that we recognise that when it comes to public health, it's not an either or. Keeping people whole and healthy and making sure they can make the most of all of their lives is absolutely critical. We know it can be done. We know we can defeat HIV. It just requires us to maintain the same degree of purpose and commitment that you and the other commissioners have shown. So thank you.
Thank you. And I'm going to take the opportunity, because you've joined us here live, perhaps to ask a couple of questions. And I know you've the government's had a real task at hand this year, having to deal with COVID-19, and in your role in helping to coordinate that response, are there any lessons you're able to draw from this about perhaps reacting to viruses and finding ways to manage, tackle and mitigate them that we can then use for HIV?
Thank you, and I think there are certain things that we can all learn. The first is the importance, I think, of leadership beyond politics. So what you've done, Daminga, what Elton John and what so many others have done, is to reinforce the fact that this is a collective effort on all our parts. Yes, government is in the lead, but we need to involve society in its broadest sense as well. And we need people like you, Sir Elton, and your other commissioners to hold us to account. That's the first thing. Government needs to be challenged and then supported if it does do the right thing. I think the second thing as well is making sure that we have a proper appreciation of what science can do. Science cannot transform the picture when we're fighting any sort of virus overnight, but what it can do, properly supported with proper investment, is find our way through. So antiretrovirals in the past, PrEP now, all of these are scientific breakthroughs which enable us to beat back this virus. And then the third thing is to recognize that it is everyone's business. The whole point about these public health challenges, HIV and COVID, is that it's just not good enough to say that it's someone else's problem or I'm less likely to be affected by it. Public health, the health of the whole nation, is a collective endeavor. And therefore, young and old alike, we're in this fight against COVID together, and young and old, whatever our backgrounds, we have a shared, not just interest, but mission to make sure that we deal with the spread of HIV, because it robs us of talent, it devastates lives, but we can beat it.
Yeah, indeed, and I love your focus on this idea that we actually really have to collaborate and work together. And as we travelled around England and had some of our open sessions, we saw a real difference amongst some of the cities. Some were very coordinated with the voluntary sector, with the the local governments, local authorities, the health service. It was all very different. And you stress the importance of sort of everyone working together. Is there anything, particularly I'm thinking about with the devolved governments across the UK, is there anything that your department can sort of do from the centre to try and help join people up and get this wonderful collaboration going?
Absolutely. Of course, you're absolutely right that responsibility for the NHS is devolved in Scotland and Wales and Northern Ireland, and they all have their own health ministers. But I know from the conversations I've had with Matt that his counterparts in Scotland, Wales and Northern Ireland, Jean Freeman, Vaughan Gethin, Robin Swan, all share this mission. And what we can do is that we can use some of the the scientific heft and expertise that we have in England to help. But I also know that the dedication in particular of clinical leaders in Scotland to dealing with this challenge has been inspirational. And the key thing is, and it's at the heart of science and it's at the heart of public health, sharing that information and making sure that breakthroughs in one area can be quickly shared with others, and also just making sure that the NHS is properly funded across the United Kingdom as well.
Thank you very much. Really, to come and show up on our special launch today on World AIDS Day is much appreciated. The commissioners we feel very honoured that you've given us your time today. So thank you very much, Michael.
Thank you, Damien, and please pass on my thanks to all of the commissioners for the really important work that we've done. And we'll be reporting back every year on the progress that we make. You've set us some stretching targets, but they're the right targets to aim for. So thank you. Well,
great. And this is being recorded, so we'll be able to hold you to that. So that's wonderful. And now we're going to go to our next session. And thank you very much, Michael. We're now going to go to our next session, which is actually to hear from some of the commissioners. And Ian Green, the CEO of Terence Higgins Trust, is going to chair this discussion. So over to you, Ian.
Thank you very much, Inga, and good morning, everybody. As Inga says, I'm Ian Green. I'm the Chief Executive of Terence Higgins Trust, one of the 3 charity sponsors of the HIV Commission. I was 31 years old when I was diagnosed with HIV. That's 24 years ago. And I was told then that I should expect to have 8 years left to live. At that moment of receiving a HIV diagnosis, my world stopped. Today, that someone with HIV can have a normal life expectancy and with effective treatment can't pass the virus on to their sexual partners is quite remarkable. But that doesn't go far enough. We believe, as charities and the HIV Commission believes, that we have all of the tools in the toolbox to end new HIV transmissions in England. And I passionately want no one else to have to go through a HIV diagnosis as I did 24 years ago. This commission, led by a combination of experts in fields beyond HIV policy and also people living with HIV, is going to be key in tackling stigma, reducing health inequalities and meeting the goal of England being the first country to end HIV transmissions. And I'm delighted to welcome as our panellists 3 of the HIV commissioners who've given so much of their time over the course of the last 18 months to focus on this absolutely achievable goal. So firstly, Mercy Shabemba, who is a HIV campaigner, a winner of the inaugural Diana Award and the co-chair of the Sophia Forum. Dr. Rob Berkeley, a former director of the Runnymede Trust and founder and managing editor at Blackout. And Dame Alison Saunders, dispute resolution partner at Linklaters and a former director of public prosecutions and head of the Crown Prosecution Service. So commissioners, first of all, thank you so much for coming to help the launch of the report this morning, but also for your time and your commitment. As has been mentioned by Inga, that you've come up with 20 key recommendations. I just would like you to reflect on, if you could pick one of those, what would be the one that resonates most with you and why? And perhaps Mercy, if you'd like to go first.
Absolutely. For me, it's recommendation 19, and it's about commissioners working with local providers and community organisations to ensure a better co-delivery. And the sense that we got from all of the trips we did across the country was that there needs to be a joined up approach to make this happen. Everywhere we went, a service would say to us, we're doing our part, we're doing this, but it's not quite joining up with so-and-so over the road or so-and-so doing this. And so for me, the really important and key thing is that everybody clubs in together and shows that actually a cross-sector approach to this is the best way that we're going to get things done.
And Mercy, there were some really good examples of where that's working well, wasn't there, when there's some really good integration, how that has a positive impact on HIV prevention strategies.
Mm-hmm. Exactly. And as someone living with HIV myself, it's much easier to not have to deal with all the bureaucracy and going to this place and this place. But actually, if everything can be together and we look at things holistically, then it provides better care, and it means that I'm more willing to engage.
Thank you. Rob, the recommendation that resonates with you most?
Will it be the first one, the one which addresses health inequalities? I think that the story of the year has been that we can see how a virus impacts differently. And we've also seen people in the streets in the middle of a pandemic fighting for their rights, arguing about racism, and trying to make progress in that space. If we can design the next stage of our response to HIV in such a way that understands the inequalities that we face in terms of gender, sexual orientation, and race, we're more likely to come up with a solution that suits everybody. Not just suits everybody, but is actually the solution that we all need.
Thanks very much, Rob. Very, very, very powerful. And I think that you reflecting back, as you say, to what's happened over the summer really reinforced the importance of ensuring that in the HIV response, health inequalities are just not an issue whatsoever. Alison, your reflection.
Testing is the one I would pick out, the recommendation, because so much depends on testing. We heard about quite a lot from people when we met them about late diagnosis and the impact that that had. If you aren't tested, you can't have treatment, which means you can live with HIV in a way that's good. Likewise, it means that you may be at risk of transmitting it to other people. So I think testing and making testing completely normal. So we heard a really good example of testing in maternity treatment. So when you go along for your checkups, you opt out rather than opt in, so it's automatic, and that's reduced vertical transmission from mothers to their children by down to 0.05%. I think it was 0.5% in the UK. So phenomenal success. And if we can roll that out across the board, so you're tested automatically when you go to A&E, when you register for your GP, when you go for cervical tests or any other routine tests, and I think that will really make a significant difference and help us to eradicate HIV by 2030, because at the moment I think it's about 6,000 people that we think are undiagnosed. So if all of those can be diagnosed, then that will make a significant difference to achieving our ultimate goal.
And Alison, that we know very clearly that testing is so easy and straightforward now. I know from Terence Higgins Trust experience that we've been able to provide 50,000 self-tests for people over the course of the last 12 months. And so it's absolutely straightforward and should be normalised.
Absolutely. And that will go a long way towards reducing the stigma as well, and also making sure that everybody, Rob's point, everybody can access it, no matter if they go into treatment centres, if they go into sexual health centres, or they want to try at home and have their own testing kit at home. So I think it's that making sure everyone is tested. It's an opt-out, it's not special, it's just normal, and we should all be doing it.
Thanks, Alison. Rob, stigma is another key issue that came out of the Commission's considerations. What does that focus mean for you in terms of needing to tackle stigma if we're going to really focus on encouraging people particularly to get tested?
It's really clear that we need to have a conversation about sex and relationships normalised right across our society, so that we can have a response to HIV. So when we saw last summer people in the streets outside schools arguing about sex and relationships education, this is part of that response. The part of the response must be that between generations, in all parts of our communities, we need to be able to have an honest conversation, facing up to some of the difficult challenges around talking about sex, talking about relationships, but making sure that we have a response to HIV, so that people aren't dying and aren't being put to detriment because we're worried about a difficult conversation.
Thanks, Rob. Alison, what did you find most surprising and unexpected about being involved with the HIV Commission?
Apart from being asked to be on the commission, which was a great honour, so I'm very grateful for that. But I think really what surprised me was that still, after all this time, the stigma that's attached to HIV, and particularly amongst health professionals, which I really didn't expect. And we heard Inga mentioned in her speech about professionals double gloving, talking as though the patient wasn't there and talking about how they would deal with the disease. So that was a huge surprise for me, and also that services were not as joined up as they should be. So when you might go along and you want some treatment for HIV, it's not just the physical treatment, it's not just getting the PrEP pills, there might also be mental health issues or some other issues. But it was really difficult for health professionals, and we heard this in a number of areas when we went out, really difficult for even for the professionals to access all the treatment that the patients might need, the individual might need, to make sure that they were properly supported and could live their lives with HIV in a safe way, which sort of, you know, meant that they could have a long and happy life. So I was really surprised about those things.
Thanks, Alison. Mercy, as somebody living with HIV, what does it mean for you to be part of this commission?
Yeah, it was really important to me to be able to sit around the table and share my views and perspective on what this actually how this would actually change my day-to-day life and the life of the community that I'm a part of. And I always said, you know, I'm 22, by the time 2030 comes around, I'll be 32, and I would love to tell my family and, you know, my children, look, you know, we did it, we actually managed to achieve it. I've always been a very driven person. When I was 8, I made a life plan until I was 40. So it was great to be able to make this plan and not have to be the one to execute it, but say that actually I played a really pivotal part in ensuring that this was truly the right thing, and we recommended the right approaches. And it's been great fun, so amazing.
Wouldn't that be amazing, wasn't it, just to think that we can have that time when no one else would have to have that HIV diagnosis, because absolutely that's achievable. I just want to thank you all once again for your commitment to the process, for engaging in conversation this morning. I think you've all become HIV activists, which is wonderful to see, and I look forward to engaging with you as the 3 charities in particular think about how we're going to take forward the recommendations, and really importantly hold the government's feet to the fire, which we know is something that is really, really important. But thank you once again for your commitment, and I'm now going to hand over to Anne.
Thank you, Ian, Mercy, Rob and Dame Alison, for your incisive and inspiring comments in that conversation. I'm Anne Aslett. I'm Chief Executive of the Elton John AIDS Foundation. Today has shown what vision and partnership can achieve. We know that ending new HIV transmissions is possible. We know it's government policy, and thanks to the Commission, it is, as Deborah said, now a roadmap. It's a practical plan, and it's within our grasp. I've seen firsthand from the programs that we support, especially our social impact bond in Lambeth, Southwark and Lewisham, how one of the Commission's key recommendations, and something we've talked about a lot this morning, opt-out testing, can make the most enormous difference in hospital emergency departments and GP surgeries. When we make testing routine in these and other settings for all patients, The results are exponentially better. The fear and pain and illness is dramatically reduced, and the savings for the NHS really mount up. And that's something that's essential given the other threats we need to tackle. Late diagnosis, which still accounts for 40% of HIV diagnoses, are bad for patient health and the chance of ending new HIV transmissions. Testing isn't exactly a silver bullet, but it isn't far off, and the sooner this is sorted, the better. We're really delighted that so many of you have joined us today. Your resolve, your insights, your determination have made this possible. We have, as has been said before this morning, a decade to achieve this big goal, but we don't have time to spare. If everyone on this call, over 500 people I can see, sent the report to a friend, tweeted the message to their followers, wrote to their MP, this would form an unstoppable momentum for change. And the HIV sector has created its own momentum before. We can do it again. We've heard from the government today that they share our vision, and now we can hold their feet to the fire. And the opposition support our vision too, but words are not enough. The commissioners, our teams at the 3 organizations who've made this happen, and the wider HIV sector will be working to see those recommendations implemented in full, and the HIV action plan published no later than summer next year. We need your help at every step of the way to get this done. So please go to hivcommission.org.uk to see how you can help and support this progress. Finally, and echoing Elton's opening remarks, it is my honor to thank our commissioners, Dame Inga Beale, Joshua Graf, the Reverend Steve Chalk, Dr. Rob Barkley, Steve Bryan MP, Wes Streeting MP, Dr. Richard Horton, Mercy Shabemba, Gareth Thomas, Mahmoud Amian, and Dame Alison Saunders. I'd also like to thank our co-chairs from the advisory group, Matthew Hodson at the National AIDS Map, and Professor Kevin Fenton of Public Health England, and all those who gave their time, expertise, and wisdom on the advisory group. It was absolutely invaluable. I'd also like to thank the Commission staff, Louise Guerra, Katie Clark, and Andy Dyer, and to everyone who gave evidence, hosted visits, and shared insights over the last 15 months. And most importantly, to those living with HIV who share their testimony, your personal experience of diagnosis, treatment, stigma, and the lives you now lead. As ever, you have been so generous with your time, and we're thankful for the inspiration that you provide on a daily basis. Finally, it's my honor to introduce Lord Fowler. He first led the government's response 5 decades ago, and he's never shied away from being an ally, advocate, and action-orientated public servant. His passion for tackling HIV remains unabated. So now, the Lord Speaker, over to you for the final word. Thank you.
We've come a very long way since I set up the National AIDS Trust in Britain in the mid-1980s. At that time, we knew comparatively little about HIV and AIDS. What we did know was that HIV was very often a death sentence, because what we also knew was that there was no cure and no vaccine. In the face of this challenge, we started the biggest public education campaign in Britain since the Second World War, Don't Die of Ignorance, advising people how to keep safe and, for example, telling drug users to use clean needles. My ambition was to make this country a model in tackling the spread of HIV. The independent HIV Commission report published today gives us the blueprint to achieve just that, to lead the way in tackling HIV. As ever, the building blocks are testing, increasing HIV testing across the health service so we diagnose everyone living with HIV, education, national and local education, and also awareness campaigns. And then, of course, there is the very big issue of addressing stigma. A few years ago, I went to many countries in the world looking at the position on HIV there. And there was no question at all that one of the very major obstacles that stands in the way of treatment is discrimination. People being discriminated against by governments, by their own families at times, but all the time standing in the way of effective treatment. So the fight to prevent the spread of HIV is not just a health issue. It starts with asserting the fundamental right of human beings to live without discrimination. The challenge that we face is a fundamental challenge. We must now turn the 2030 policy commitment into a plan of action. And the HIV Commission report is a very, very good place to start. I would like to congratulate the Commission on their work and to wish them all possible success over the coming years.